Dr. Emily Schultz, and she is a board-certified neurologic clinical specialist in physical therapy and a certified telehealth rehabilitation practitioner working for the University of Miami Outpatient Physical Therapy Division. Dr. Schultz is a postdoctoral graduate of the prestigious University of Southern California, and I live in California, and Rancho Los Amigos Neurologic Rehabilitation Center Neurologic Physical Therapy Residency Program, and currently serves as core faculty and mentor in the University of Miami and Jackson Rehabilitation Hospital Neurologic Physical Therapy Residency Program. So Dr. Schultz, you're up. Thank you.
Hi. So I was fully relying on Colleen to get everybody moving after I was done talking. It's a little out of order, so I'm going to ad-lib a little bit here, and if it's accessible to you, everyone stand up. Okay, now sit down. And then stand up. And sit down. Okay, 2 more times. Stand up. And sit down. Last time, come up and stay standing. This is a lot of information, so just take a deep breath and then blow it out. And then one more. Deep breath. Blow it out. And then just like shake, just like move, like release your energy. Okay, go ahead and have a seat. So my name is Emily. I'm a physical therapist, and I'm really thankful to be able to be here and talk to you guys today about something that I'm very passionate about and has been touched on in a lot of talks, and that is exercise. And I view it as the active ingredient of your dopamine cocktail. So I want to give a special thank you to a colleague, Claire McLean, and the team and clients at Rogue Physical Therapy and Wellness, which is located around Huntington Beach, California, so quite a distance away, but they gave me permission to use some videos today that I think will be really motivating for the people in this audience. So I want to touch briefly on what I do as a physical therapist. So I work with people providing skill-based training to help enhance and maintain mobility. We also have a big role in preventative health, where we work with people to help prevent secondary movement problems or to keep them active. We also work with people, I think most importantly, to help them initiate and create a long-term activity program that's going to be adopted into their lifestyle and really be that it factor for staying well and moving well. We work with individuals along the lifespan at all different time periods, seeing people after they receive a diagnosis. Maybe this is before you're experiencing any type of motor symptoms. We do like to do baseline assessments to capture where you're at now, so that way we can track these things across time. Early on or at any time, we also work with people to help them start moderate to high intensity exercise programs. We look at safe parameters and protocols that are good for you and your overall health and other conditions that you may have to really jumpstart your commitment to wellness. We work with individuals if there's a change in functional status. This can be if you're experiencing some more difficulties with your movement, but also if you are feeling better and you're ready to take your exercise program to the next level and be more challenged. We work with individuals when they have pain to help relieve that pain and help prevent pain from impacting regular exercise. And we also work with people to address specific functional goals. So in physical therapy, I'm often working with people for a chunk of visits, maybe a few months, We then take some time to pause, where during that time together, we're developing these programs, and then you go off on your own and continue living well and exercising independently. Later in the year, or maybe the next year, you come back to see me, we touch base, we address any challenges or progress your exercises, and that ebbs and flows throughout the lifespan. It's like the dentistry model, but I feel like it's way better than going to the dentist, I hope, even though, well, maybe they can be equivalent to leaving a good taste in your mouth. So I want to touch on what physical therapy is not, because that goes into a lot of what my other talk is. It's not personal training. So personal trainers are amazing. They're a great resource to help you develop fitness and wellness goals. But in physical therapy, we're working towards those skilled functional goals. Physical therapy is not your only form of exercise. This is really, really important to know that commitment to exercise outside of those appointments is really what's going to help you feel better longer. And physical therapy is not continuous without pause. So this I know can be sometimes very challenging, but it's why developing that regular wellness routine is so important. And also really what motivates the rest of my talk today, which is because what happens when you're taking that break from physical therapy is that you take control, right? Exercise, living well, commitment to wellness is an area that you have total autonomy and control over. This process, even just everyday life, can feel very out of control. And I hope to inspire you to feel that exercise and living well and moving well is something that you do have the tools and the capacity to take control of and to take it back. So how many of you in here have been told to exercise because it's good for you? Everyone, right? But how many of you know why it is good for you, specifically, a person with Parkinson's disease? Good. So if not as many hands, right? So that's really what I want to talk about today. And I'm going to start with just a little bit of literature. This was published just last year. Across 8 years, they followed 11,000 people with Parkinson's disease. And what they found is that people who were performing regular physical activity had a reduced mortality rate. They were living longer. This was true even when they controlled for other comorbidities, such as age, diet, maybe heart disease, diabetes. Those who were maintaining a level of physical activity were living longer. And the people who were more active were living the longest. Now, why is that? Well, because we know that aerobic exercise and just exercise in general can alter brain function and structure in Parkinson's disease. Now, this study, what I really liked about it was that it had 2 groups of individuals. One group was exercising at home 3 days a week for 30 to 45 minutes on a bike, about a moderate intensity. The other group was not instructed on any specific exercise. The group who was exercising in their own home had improved functional connectivity in the basal ganglia, reduced brain atrophy, and improved cognitive performance, leading the authors to conclude that aerobic exercise stabilizes disease progression on a brain level and enhances cognitive performance. Now, what is this saying? It's saying that we need to get active and we need to stay active in order to live longer and be healthier. But we know this. We've known this for a long time in the medical community. There's been studies for decades and more looking at various types of exercise and the impact that it has not only on movement symptoms, but on the brain for individuals with Parkinson's. And I bolded one because I think this is really important to think about when we think about dopamine. But exercise increases the dopamine's release from portions of the basal ganglia. And individuals who are habitually exercising have a greater dopamine release. So you are able to generate more dopamine on your own by exercising and being consistent with that. There is no other treatment that can impact your symptoms and the multiple centers of the brain involved in Parkinson's disease, as well as exercise. And you have control over that best level of treatment. I was ahead of myself. So I have some questions here. A lot of people ask me, what do I need to know about exercise? I think it's important to know about the intensities and also know that no intensity is perfect for each person, right? You want to find where you fit. So there's vigorous activity, moderate activity, and light activity. And I've listed on there some examples of ways you can be active at those intensities. But what's really important is that you find the zone that is safe for you, and one that encourages you to keep going. So this is something that you can work with a physical therapist or another healthcare professional to find, or maybe you've already been exploring this on your own. But remembering here that all of these levels of activity were studied in that first article, and regardless of the intensity that the people were exercising at, those individuals were living longer. Okay, so you don't have to be forced into one realm. How often should I exercise? Well, from that first study, it's recommended to do vigorous exercise 3 times a week for a minimum of 20 to 30 minutes. Or if you're someone who's exercising at a light to moderate intensity, 5 days per week for 30 minutes. Now, more than that, there was a really nice study that was done that kind of said 3 days a week was the minimum commitment for exercise to see improvement in Parkinson's symptoms and overall disease progression. And every day on top of that was more additively beneficial, meaning exercising 5 days a week was helping to slow disease progression and symptoms more than 3. What's really important to touch on here, because I mentioned physical therapy is not your only form of exercise, that frequency is usually 2 days a week, same with maybe other classes. But 2 days a week or less did not have any impact on slowing disease progression or symptoms. So it's really important that you are finding avenues for exercise that can have consistency in your routine. Any activity is good, more activity is better. What can I do? So you can do pretty much anything. I think sometimes it's overwhelming when you're told that, right? They've done research on walking, treadmill training, biking, yoga, Tai Chi, boxing, dancing, resistance training. The list goes on. The best part about it is that every single one of those modes of exercise has been shown to be helpful on that brain and physical level. So the question of what you can do really comes down to, what do you like to do? You know, what brings you joy, as Colleen was saying earlier, and finding the avenues to be active in your own way. Being active in your own way requires you to know your values. Is time with family really important to you? Maybe you structure family walks in the evening. Is social and community really important to you? And maybe you're taking amazing group exercise classes like the one we had up here earlier today. It's important to set goals that are specific, measurable, achievable, realistic, and time-bound. Setting goals can be a challenge, so you can consult with somebody else to help do so, but I really recommend writing them down, getting things down on paper so you can look back and see how you're working towards those goals can be a really good motivating factor and an accountability check. Then it comes down to making an action plan to reach those goals. So your results are really only as good as the plan you have in place to reach it. Maybe this is bringing your gym clothes with you when you're going out to run errands, so you stop at the gym before you come home, or laying out your exercise clothes the night before. So first thing when you wake up in the morning, you get up and you go to the gym. Whatever plan you feel is going to be that cue to integrate exercise into your day more regularly. And this will vary for everyone. But it's really, I think, important to know that there's not one specific thing you need to be doing, right? It really comes down to finding what brings you joy, finding something that you want to do on a frequent basis and that you can commit to regularly. So some myth busting, and here's when we get with the videos. So I feel like there's sometimes some preconceived barriers to participating in exercise. And so I hope to shatter a few of those for you today. So it is important to know that you can participate in meaningful exercise from a chair or a bed or on the floor. And these exercises can be pretty intense. I've worked with a few people in here, and usually the exercises where we're on the floor are everyone's least favorite. So the Parkinson's Wellness Recovery Program is a really good program that has routines that are done completely in sitting or in lying down, focusing on intensity and amplitude of movement. I have a video here. This is Claire, as I mentioned. So I want to scroll along just to get like some brief examples of some of the exercises you can do from a chair level. You can use weights, different levels of equipment, but these classes are available and sometimes online as well if they're at a distance to be able to participate in, if you're someone who doesn't feel confident on their feet but wants to exercise on their own. The exercises on the floor, as I mentioned, we'll have a video here. It can be, again, sometimes challenging to go through transitions, rolling, getting up onto your knees, things like that. So practicing those movements repetitively can become a really intense exertional challenge and also help foster improvement in those skills. So there's a lot that can be done eliminating that fear of falling or that risk of falling while you're moving on the floor. You can participate in meaningful exercise if you use a walker or maybe move a bit slower. Exercise doesn't look the same for everyone. There's plenty of group classes that do dancing where you're holding on to a stable surface to feel confident. And you may start moving a bit slower, but as you continue to move, that speed will improve. I have a video here that I'm going to play that shows an individual who experienced a fall. She had been a regular exerciser previously, just in group classes at Rogue, and she experienced a fall, had some time away from exercise, and experienced a lot of bradykinetic movement following. But as you see with each round of this circuit in the same day, she's beginning to move faster, take bigger steps, and get back to feeling like herself. It's really nice here to see a comparison at the end, but significantly faster, right? Just across that one day. And this is happening for somebody who prior to the fall had been participating in regular exercise. So she had that foundation where her brain was and her body was able to tap right back into the capacity that she had, even if she didn't start there. And that's what that long-term commitment can build for you. You also do not need to start at a vigorous intensity for exercise. As I mentioned earlier, going 0 to 100 and then having pain or extreme fatigue is not very motivating to be able to continue to exercise. So really start at the appropriate level for you. We walk before we run, right? And as with starting with any habit, that same principle applies to starting an exercise program if that's not something that you're currently doing. What it comes down to is committing to your health. And that means committing to yourself because you do have this control. I want to end here with a couple more videos. I showed you what could happen in one day, but now I'm going to show you what can happen with more time. These two videos are a month apart for an individual who participated in group exercise 4 days a week. He experiences some freezing, as you can see across 1 month of time, his ability to navigate those challenging activities significantly improved, not only in speed, but in balance and in step length, from committing to exercise regularly in a class form for 1 month. Here's the same individual walking after 1 month of regular exercise. And if that is not enough for you, I want to show you Dennis. Dennis, you're going to see videos of him across the time span of 6 years. What do you notice? He's 6 years older. He's had Parkinson's for 6 years longer, and he's moving much better because he committed to himself and staying active. You can do this too. We do not rise to the level of our expectations, but we fall to the level of our training. And I hope, if it's not already begun, that your training starts today. Thank you.
Thank you so much. That was wonderful. I'm taking tips too. So how many of you are taking some mental notes? What you're going to do? Great. So we're going to go on to our next